my name is Liz and my son's name is Logan. He's an 11-year-old boy who was diagnosed with ADHD and anxiety and behavioral issues when he was 5.
Hello, my name is Jennifer and I am the parent caregiver of a child living with medical complexities.
My daughter Malia is a 6-year-old who suffers from a severe form of NF1, which is a genetic non-cancerous tumor condition. She has tumors in her brain, spine, and abdomen that have caused a series of other medical conditions and has shortened her life expectancy.
He was seeing a psychologist, an ADHD doctor, a speech therapist, and a behavioral specialist. Around first grade, we decided to start medication. From that day on, I felt like he was just a science experiment. Despite all the medications we tried over the years, nothing seemed to work.
Malia requires assistance with all of her care. She is trach and ventilator dependent, wheelchair bound, and currently has 42 medications listed in her care plan.
The very first time I spoke with Dr. Quinn, I felt hope. She had us do a genetic test. When the test came back, only one of the 5 medications that I was giving my son were helping him.
I think I had this false idea that all of her providers just were always overseeing and monitoring her medications. But since utilizing the service, I discovered that a lot of her medications were no longer at a therapeutic dose. Some of the medications interacted with one another. And then even some of her meds were the cause of her symptoms that she was experiencing.
Perfecting Peds was with me every step of the way. I would get a fast response, much quicker when I would text them than I would from our own doctor.
Working with Perfecting Peds was actually pretty simple and straightforward. I sent the pharmacist the list of my daughter's active medications. She reviewed them with me and contacted the members of her care team to make the required medication adjustments.
And you know what? Slowly, Logan began to make breakthrough after breakthrough. Everyone needs a Dr. Quinn on their team. They're the missing cog in a very large machine of specialists, and they're an advocate that all families need.
Even in the midst of all of these other care needs and challenges that we have, that we just have someone who's taking care of it. When I'm envisioning Molly's care team members all sitting at the table and discussing her care, I see a pharmacist at the table. A pharmacist is necessary. It's not negotiable.
When I told my teenage daughter what I was doing, she said that she hoped Perfecting Peds got the money that they needed to go big, because every kid needs a group like that on their team. And she added, "Make sure you tell them how much Perfecting Peds changed our lives, Mom." So I guess I'm not the only one who's realized their impact.